So what does good survivorship care, or what does supporting people with cancer to live well look like? So there is a number of different sort of models and frameworks in this area. But we tend to refer to this model, which is the COSA model. So COSA being the Clinical Oncology Society of Australia. And this really outlines the key elements of survivorship care. And as you can see, starting from diagnosis, the importance of sort of education around self-management and long-term well-being, information on the treatment, psychological support, behavioural sort of aspects such as psychological treatment as well. But there is this sort of clear transition period from when somebody moves to the end of primary treatment, where a needs assessment should be conducted. So a health professional needs to really understand and do an assessment of that person's need to ensure that their care is tailored to those needs. And it's really important that that's done before that person ends treatment, and that they're also provided with a survivorship care plan. So a care plan outlining a sort of summary of their treatment, as well as all the supportive care elements which are addressing their needs as well, and making sure that they have input from a multidisciplinary team. And as I said that before, it's not just about the physical aspects of care. We need to consider the psychological, social, spiritual, lifestyle and environmental factors, which all sort of affect a person going through cancer, regardless of what stage that they're at in their cancer journey. And then it talks about sort of a risk assessment that's done sort of after follow-up care. Depending on that risk, people are then sort of managed in the community or via their specialist, which also includes allied health and other members of a multidisciplinary team, but also acknowledging primary care as well, so GP and practice nurses. So this is just one model, and I just want to acknowledge that I guess optimal care may look very different for different cancer patients, regardless of where they are at their journey, but also their individual needs as well, which is why this needs assessment is so important to really kind of plan out that care